My name is Thanasi, I'm a plastic surgeon. I've been working at the Aberdeen Clinic probably for about 6 months now. My connection to Aberdeen is that I came up to Aberdeen from England for plastic surgery training maybe 10 years ago, and both my wife and I really loved the place, so we always wanted to come back. Then when I completed my training, we both went to New Zealand, and I was a plastic surgeon there for a couple of years. My main interest has been reconstruction and cosmetic surgery, as well as dealing with a lot of skin cancer and skin issues. So towards the end of my training, I then went to Holland, to Austria to work in some cosmetic clinics and do those kind of treatments, which I've always been interested in. I've been a consultant here now for 2 years in Aberdeen, and I suppose I was looking for a friendly environment where I could provide a high standard of care and kind of the personal touch, as well as the time with an individual to find out what they want and what I could offer, which is one of the things that attracted me to working here. So I work full-time in the NHS and also at the Arline Hospital for sort of larger cosmetic procedures. So generally it depends what it is. If it's something minor, such as skin lesions, I've removed contraceptive implants from arms, things that traditionally you'd have to wait a very long time for in the NHS, whether it's a year or 2 years. I do those procedures here under local anaesthetic, and I feel that's a really good service. All the skin lesions are sent off for analysis as well, so they're getting a similar service to the NHS, but faster and more personal without a waiting time. The consultations are as long as they need to be, and they're really about finding out what the individual patient wants and what their concerns are. And really it's an opportunity to see what we can offer, particularly the minor skin lesions. We can offer surgery on the same day if the person's happy to have that, but also it's about providing information and advice about the kind of results that they can expect, the sort of complications that can happen, but also how their wounds are likely to heal. So that first consultation is very much about explaining what we can do, what the results are likely to be, what problems they might anticipate, and give them impartial advice about whether we think it's a good idea. So it's not really a pressurized selling kind of environment. It's really offering the information and diagnosis, and then if they want to proceed, then that's up to them. From my perspective, I find it a very friendly place to work, and it's been very welcoming from the first moment that I started working here, and obviously working with people that you like makes life a lot easier, and it's a very relaxed environment, and I think that comes across to the patients that come through. Everyone knows each other. It's very well organised in that we're a small team, so that it's a very personal service, and we all can sort of work to our own areas of expertise, but work together so that everyone benefits from the other sort of specialists that are working here as well. We're not a faceless service, in that the patients that come through will also get to know us, and they'll get the follow-up with the same people that looked after them. So there's never that sort of sense of being on your own or not having anywhere to call, or not knowing who you're going to talk to. As I said, it's a pretty small group of people here, so you'll always end up talking to the same person. They'll know about you, the concerns that you have, and that just makes it a lot easier to convey the information, and also any problems, anxieties, you're kind of not isolated on your own. And that's an important aspect of the service that we provide. The other service I also consult for aesthetic procedures, which might need to be under general anaesthetic. So whether that's facial cosmetic surgery, eyelids, faces, brow lifts, Botox fillers, that kind of stuff.
Okay.
But I also operate at the private hospital here at Arlbine, so there's that pathway for the sort of slightly larger things.
Okay.